Hey everyone, welcome back to another Facebook Live interview with the National Spine Health Foundation. I'm your host, Erica Anderson, and I'm so excited today to be kicking off the Spinal Health Awareness Month with an interview with Dr. Thomas Schuler, who is the founder and CEO of the Virginia Spine Institute and the chairman of our medical and scientific board here at the Spine Health Foundation. Dr. Schuler, thank you for joining us today.
Oh, thank you for having us. So excited to help launch this important month.
Yeah, well, we know you're very busy, so we really appreciate it. I want to kick things off by asking you to tell us a little bit about yourself and why you went into spine and what makes you so passionate about working in this field.
You know, there's many reasons we end up in a field, but for me, I loved and in college was fascinated by physiology and the human body, and so medicine was kind of a natural step for me. And one of the great things about medicine is that we're able to help people and really take care of their problems. But I was also very much interested in doing stuff with my hands. So becoming a surgeon became a natural step. And through that, just the ability to improve people's lives, change people's lives for the better is just so rewarding. And that's a big part of the profession. The other part is the absolute fascinating technology, understanding the human body, understanding all the different aspects of making a person function better. And so it's this combination of being able to help people, but then doing something very intellectually stimulating and technically challenging. And it was that combination that really drew me in. And ultimately, after looking at all the different careers, I found spinal surgery just to be the one that was a perfect match for my interests, my talents, my philosophy. It's a complex area and it's technically challenging. Probably done properly is probably the most difficult area in healthcare. But it's something which just perfectly matched my skills, my desires, my interests.
Well, and we know so many people have benefited from that work that you do. As chairman of our medical and scientific board, what are some of the things that you're most proud of with the foundation, and what are things that you're looking forward to or hope for in the future?
The National Spine Health Foundation is truly a great organization. We're fairly young. We've only been around for 18 years, but spinal healthcare as a specialty is fairly young. Spinal healthcare as an area of medicine really has only been around the past 20 to 25 years. And so there was no organization out there to be the ambassador to the patients, to communicate to the patients. And you hear about the American Heart Association, the American Cancer Society, and those have been around for a long, long time, decades and decades. And so we built the National Spine Health Foundation to be the go-to source for patients, to be the way to communicate with patients. And given the new technology we have now with internet and web based learning, this is the perfect vehicle and the perfect time in this new specialty to have this entity. So we're very proud to have launched to the spine world what you have for the heart world and the cancer societies for the cancer world, and to be the go-to source, the reliable source for people to understand what works, what doesn't work, how to get better, that there is hope.
Yeah, absolutely. That reminds me of our gala coming up next month, which is a theme of out of pain and into hope, and that is really what we want to offer at the foundation. I want to ask you, as a pioneer in some of the very early technologies like motion-sparing disc replacement and bone morphogenic protein, what are some technologies you think will revolutionize the next phase of spinal healthcare?
Well, it's interesting. This new century that we're in is really a biocentury, and it's using biology to heal and using genomics, the genetic code, to solve the problems. And that's what we're working on. We're doing a lot of work with regenerative medicine right now and healing injured discs. So instead of having to operate on somebody or telling somebody that there's nothing that can be done, we can use their own biology. We can harvest their bone marrow or their stem cells from their fat cells and use it to heal injured structures, discs, ligaments, joints, and truly amazing at what we're able to achieve without having to operate on people. So we get them better, faster, and help them. and ultimately working with gene therapy to try to prevent disc degeneration or reverse it. That's where we're going, and that I expect in the future. And so, just this ability to change. In the past, somebody comes in with something broken and we fix it. And where we're going to be heading to is, how do we minimize what we have to fix, or how do we prevent it from breaking? And that, I believe, is the future of spinal healthcare.
Yeah. I know I love you talking about the recovery time, because that's something that I keep hearing so much about, is how much that's improved in the past, 10, 20 years. And I've heard so many people on some of our Spinal Champion videos just talk about, just say, oh, Dr. Schuler changed my life. Dr. Schuler gave me my life back. When you hear those patients saying things like that, how does that make you feel?
Well, obviously, it's very flattering, but it's what drives us. It drives us to do what we do, and the purpose of the Virginia Spine Institute is we improve lives, and so that's what we focus on. Everything we do, every act we do, is trying to improve the life of our patients, the lives of the people around us, and so a way to hear these accolades come in is just an affirmation, and gives you the energy and the excitement to continue. And it really is motivating, not just for me, but for my entire team. And we all love it. I mean, who doesn't like helping people get better? Who doesn't like improving people's lives? It's so gratifying. It's the blessing of being in healthcare as a profession.
Yeah, and you have yourself undergone a spinal fusion and had surgeries. How does that, having been a patient, how does that affect how you are treating folks, knowing what it's like to be one of them?
Yeah, it makes a huge difference, because we as surgeons are a little insulated, and we're like, okay, yeah, we'll do this operation, you'll be better in a week or 2 weeks or whatever, because that's what we see them in the acute phase. And if you talk to physical therapists, you find out that no, that's a little more drawn out, because the therapists are working with patients multiple times a week for an hour at a time, and they see that's a little slower path. So what I've really discovered as a patient, is that the healing process, to where we have complete functional recovery, complete absence of symptoms, you forget you had the surgery, clearly takes longer than most in the healthcare field actually recognize, because we're not looking at it through the patient's eyes entirely. We're looking at it through, what care are we giving to people? And so the good news is that the treatments work and they're phenomenal, but it involves a significant input on the patient's part of exercise to get better, and the total timeline for complete resolution of everything than most surgeons realize. And so to completely get over a surgery, forget about it, and have the full recovery, it can be a year to 2 years to be there. Now, people are highly functional before then. I know that, I had my hips replaced as part of it. That's not a spine thing, but I had my hips replaced, and I went out and was in a golf tournament 6 weeks after the thing. Now, it was, I wasn't able to perform like I used to perform at that point, and I had a lot of work to do, but I was able to go out and do it. After my neck surgery, I was able to operate 6 weeks after, but it was a little bit of a reduced schedule, that I was not doing as many cases. But the whole point is that, as a patient, I clearly see that the demands that are on the daily recovery of the patient, the needs. And so I think it's made me a much better physician, a much better provider, to truly be able to discuss with the patients an absolute realistic recovery. I kind of use the phrase that surgeons lie, but it's not intentionally, it's out of ignorance in terms of the actual timeline of recovery. And I think when you go through it, you see what is much more realistic on the personal experience going through it. And I just think that clinicians tend to decrease their estimates, because they're not living it on a daily basis. When you live on a daily basis, you get, I think, a much more realistic perspective of the trials and tribulations of a patient through recovery. Having said that, I was back fully active at 6 weeks from procedures, and it's one of those things that doesn't mean you're not functioning. It's a question of saying, are you 100% recovered? And so that's the important question I always ask patients when they ask me, well, doc, how long till I recover? And it's like, what is your definition of recovery? And that's an important thing to understand, is, Are you able to do your job? Are you able to function? Are you able to have fun? Are you out of pain? Versus are you completely at the peak of your recovery? And
Mhm.
that is a much longer timeline.
Well, one of the things, I mentioned our spinal champion stories, and we love to share those. But sometimes when someone is first diagnosed, like they're Googling around and they find horror stories about surgery. And I think one of the reasons for that is because people that have had a bad experience are online talking about it, while those who have had a good experience are just out living their lives and they're not talking about it quite so much. As someone myself, I've had a successful back surgery and was able to get back to my own life. I ran a marathon after my back surgery. So I have one of those success stories and I try to share that as much as possible. So if someone is watching that has just learned they may need back surgery, what would you say to them to maybe calm some of the fears that they have about getting surgery?
Right. Most people see they have a back problem and they think all back problems are equal. And first of all, they're not. There's many different issues out there, and is something which can be treated with a simple therapy, a medicine, an injection, or is it something that needs a little minimally invasive microsurgery, or is it something that needs a major reconstruction with fusing, 15, 20 levels of the spine? I mean, greatly different issues and problems. But the true benefit is that spine has incredibly advanced over the past 25, 30 years. And it truly is a miracle now what we can do to help people. And we can go in minimally invasively, fix a problem, leave minimal impact on the surrounding tissues, and get people back to their lives fully. And that is, I think, the most important message of the foundation is that there is hope. There is ability to overcome, whether it's non-operatively or whether it's with some modern technique of minimally invasive surgery, or is it something that needs to be comprehensively fixed? With the knowledge we have today, the skills, the biologics, the robotics, all of the aspects that we have with artificial disc, motion preservation, all these things are phenomenal. And using regenerative medicine to try to avoid surgery or treat adjacent levels, these are all things that are so exciting. And so the answer is there is hope. People can overcome, and we see it daily. I have people that I've operated on go back, play NFL football, go back, be Rangers in the military. So it doesn't end your life. It gets you your life back. And having the right treatment done by the right people is a road to recovery and full restoration of your life and being able to be an active part of your family and your community. I've had in my neck, my low back, and it's something which is, I love to practice what I preach. So I take care of myself. If I need surgery, I have that surgery because it works and it's incredibly beneficial. So I absolutely a proponent of modern spinal health care, and I've lived it. I've had it, but I practice it. And I'm so excited for people that there are these treatments out there which are truly life improving, life changing.
Yeah, absolutely. And we at the foundation want to make sure that patients have access to all the information and the options that they have. And so check out our website. Be sure to reach out to us if you have questions. We want to make sure you get the information you need about all the options that are available. Dr. Schuler, thank you so much for joining us to kick off Spinal Health Awareness Month. We are so blessed to have you, and thank you so much.
Thank you. And everybody take care.